Hey guys, welcome back to the channel. My name's Tony Maritato. I'm a physical therapist, and today I want to talk to those of you who had a total knee replacement scheduled to be done, but because of the COVID-19, it's been canceled or rescheduled. So you're probably sitting there frustrated, anxious, wondering what you can do in the meantime because all elective surgeries, at least locally for us, have been canceled. I want to give you a couple tips and tricks that you could start using today to try to manage the pain, try to maintain your function, and try to maybe better prepare. Use this as an opportunity to be ready for surgery so that you have a better outcome after. The most important thing for any of my clients who come to see me pre-surgery, before their surgery, is we want to look at a couple things. We want the tissue around the knee to be as healthy as possible. That means the muscular system, the connective tissue, the vascular system, the nerves. We want everything that we can improve to be improved. So, a couple of things that I try to coach before surgery, usually 6 to 8 weeks before surgery. I try to get patients to become cardiovascularly fit as much as possible. Now, I know that you probably aren't out walking and jogging and riding bikes and doing those things because your knees hurt. That's why you're getting a knee replacement. But that doesn't mean the upper body is in such bad shape. And that means that if you have the right equipment and the right facility, you can do things from an upper body perspective that improve circulation, improve heart, cardiovascular health, which in turn will improve tissue healing. Now, here at the clinic, we have something called an upper body ergometer that most people don't have at home, and I understand it. To give you an idea what something like that would look like, this is one of the machines that we use here in the clinic. So my arms will go around, I can get a good kind of intensity. Another version of the same machine is this right here where I could be seated. Again, it's like a bicycle for my arms. If you don't have access to something like that, then try to find something that you can start using. One of my favorites that's low cost, doesn't take much at all, is a simple shoulder pulley system. And while maybe it's not the most exciting and it's not $5,000 like some of those machines, a $10 or $15 pulley system can help you get started. And I can almost guarantee that if you do it at the right intensity and you do it for 10, 15 minutes, you will start breaking a sweat. So anything that gets your heart pumping, that doesn't beat up your joints, beat up your knee, make your knee more inflamed, is going to be beneficial for your post-surgical recovery. Now, let's get a little more specific in terms of the lower extremity. The hip and the ankle are the main shock absorbers above and below the knee joint. And so any exercises you can perform for the hip and the ankle, those muscles also often cross the knee joint. So if I do a basic, heel raise, that muscle, my calf muscle, it's made up of several muscles, but the gastrocnemius is a big muscle. That's the one you see on the back of the person's lower leg. That muscle crosses the ankle and it crosses the knee. Strengthening that muscle will help produce a benefit for the knee, but it will also not beat up or aggravate the osteoarthritis in the knee. If I'm working on my hip, I can do side leg raises, I can do front leg raises, I can do multiple hip exercises, some rotation, without causing added stress or pain through the knee. And then of course the non-surgical side, if you have a knee that's not as bad, that's not as painful, any of your normal strengthening exercises on that will have some carryover benefit to the surgical side. So my point in all of this is to help you understand that there is a lot you can do to help prepare the tissue, to make the musculature healthy, the soft tissue, to improve the vascular system, to improve your cardiorespiratory health. And remember, the reality is most of my clients after a knee replacement are using a standard walker. That means that their arms, their shoulders, their neck, their upper back, all of it has to be strong and healthy to support their body weight while they're using the walker for the first couple days to couple weeks. Then they'll progress to a cane. You need healthy shoulders, wrists, elbow, to adequately use the cane. So there is no shortage of the number of things that you can work on now so that when you do have the knee replaced, you are going to just do tremendous through the rehab process. Guys, if you have specific questions, please post them in the YouTube comments below. If you would do me a favor to support the channel and hit the subscribe button, the more reach we can get, the more questions you share with me, the better content I can bring to you. And I'll post a playlist in the video description of different exercises you can start doing today that will benefit your post-surgical rehab process when the time comes. Again, thank you so much for watching. I'll catch you on the next video.